Good morning, everyone. Welcome to Dorsey and Whitney's webinar, Privacy Titans, Optimizing Our Neural Networks. I'd like to introduce Jamie, the chair of Dorsey's Cybersecurity, Privacy, and Social Media Practice Group. Jamie?
Welcome. Thank you so much. Welcome, everybody. We're so excited to have you with us here today. Before we get started, I just wanted to go over a little bit of housekeeping information. So don't forget to sign in. The materials and attendance form are available for download from the login and materials email sent from the email address events@dorsey.com. And return your completed attendance form to attendance@dorsey.com. Dorsey will apply for CLE in the jurisdictions listed here. So at the end, make sure you send in your attendance form so you can get your CLE credit. We will be giving the CLE codes if you need those in each presentation and in the chat. We won't have a lot of time for Q&A today, so because we have a lot that we're trying to present. So if you have a question, I would recommend contacting the speakers directly or your usual Dorsey contact. We do have the speaker's contact information in the materials. So today's agenda, we have 3 sessions, each 1 hour with 5-minute breaks in between. The first one will be about US data privacy law. The second one will cover international issues, and the third one will cover litigation, security incidents, and that sort of hot topic. Then we'll close by 11:50. So I would like to start our first panel. Our theme today is artificial intelligence. So you'll notice from all of the topic headings that that's what we're talking about. And you will see that flowing through all 3 of these presentations as it is affecting everything we're doing. It is interesting how we're seeing legislation about artificial intelligence and tons of legislation about privacy, and they're not really talking to each other or working too well together. So that's going to be an ongoing challenge for all of us in the years to come. Our speakers for the first panel are 4 of us: Austin Chambers, Ross Emanuele, me, and Bianca Tillman. Austin, Bianca, and I have broad privacy and cybersecurity practices. And Ross he's the co-chair of our healthcare and life sciences industry group. And so his practice is health privacy. And we'll talk about all those issues as we get going. So in February of this year, I delivered the opening talk at a privacy and cybersecurity conference. Some of you may have been there. And I talked about how at that time, bad actors only needed 1 minute of recording of your voice to do a voice clone of you. How could they get that 1 minute of recording? Well, maybe you spoke at a meeting at your firm or somewhere else where it was a video conference and it was recorded. Or maybe you gave a toast at your friend's wedding that was posted to social media. Or maybe you're an influencer and you're posting videos of yourself to the internet all the time. But they were able to train the AI system with 1 minute of recording, and then they could use a filter and have real-time phone calls with somebody where the bad actor would speak in their voice and the person who is receiving the call would hear the cloned voice. I'm also aware of a security incident that's happened where this kind of voice cloning technology was used to trick somebody who had known the person for 10 years into thinking it was someone else. Really scary, the fact that it could be so good. But I thought to myself, well, at least they can't clone my voice from my outgoing voicemail message. You know, the one that says, "Hello, you've reached Jamie Nafziger at Dorsey and Whitney. Please leave." It's too short. So, okay, at least that was one good point. Well, 2 months later, I'm now here to report that they only need 15 seconds of your voice now. And I've heard examples of these cloned voices based on 15 seconds of voice recording, and they're good. So that's a problem. And I timed my outgoing message and it was 17 seconds. So now I have a problem. And since then, we've had multiple things in the news about voice cloning. You probably heard about people getting robocalls from President Biden the night before one of our primaries saying they didn't need to bother to vote. There was also an incident in Hong Kong where somebody was asked to wire $25 million and he was suspicious about it. So he said, well, let's have a video conference. He had a video conference with several of his colleagues and was convinced that he should wire the $25 million. And it turned out after the fact that all of those video conference participants were not only voice clones, but video clones of his colleagues. So he was tricked. We also had a Wall Street Journal reporter who was interested in voice cloning. So she cloned her voice and then tried out different things. And one of the things she did was she tried calling up her bank with her voice clone and was able to get full access to her bank account using the cloned voice because of the voice ID security system that the bank had. So clearly our security, given how advanced this technology is now, our security systems need to change. We can't just rely on what we see and hear anymore as being the real person that you think you're talking to. It's probably not realistic for us to comb through the internet and remove every 15-second recording of our voice. So we have to beef up our security and find other ways to make sure that the person who's telling you to wire money or share sensitive personal information is really who they say they are. The speed of change in both privacy and AI is tremendous, and we're seeing an exponential growth in risk. We have so many developments we want to talk about today, so we're going to jump right in. But I encourage those who are watching to ponder. Am I really Jamie Nafziger, or am I a video clone saying only what my robot overlord tells me to say? These are the top issues we're going to cover in the first session. The proliferation of state laws. This is happening so fast that we're often finding that when we start a privacy project, and then when we are getting ready to finish it, the law has changed in the meantime. So it is really crazy. And you note that our invitation for this event said that there were 17 state laws, and now just in the course of a short time, we're up to 20. So it is changing really fast, and that's very challenging. We're also going to talk about artificial intelligence, which I've already teed up for us. Another big trend is how children and teens are treated in privacy and safety online, that there's just a ton of activity in that area. We're going to talk about changes in the ad tech industry, both those that they're choosing to make and those they're being forced to make. Another big trend that companies have been working on is trying to implement global privacy control or universal opt-out. We'll talk a little bit more about that. And then the two litigation topics, which are really key, are biometrics and these other cases, wiretapping, state constitution, common law privacy. There's a bunch of different old laws that are being used for litigation. And our third panel will be talking about those last two topics. So let's get started. I always start with federal, wishing that we might have a federal privacy law, but so far, no. There have been numerous bills proposed every year. The latest one was a couple weeks ago called the American Privacy Rights Act. You might have heard about it. It is, you may recall that the two sticking points for whether we could have a federal privacy law are two things: state preemption and a private right of action. And so the way that this bill treats those two issues is it preempts a lot of the state privacy laws, but there are quite a few exceptions to the preemption, including the Biometric Information Privacy Act in Illinois and the aspect of the California privacy law that involves statutory damages, also a genetic information privacy law in Illinois, and then a whole bunch of categories of laws that when I read it is very broad, so that I think there would be a lot of litigation over which state laws are actually preempted by this. It also does have a private right of action. but it is limited to actual damages and attorney's fees. It doesn't have a statutory damages amount. Whether this thing will take off is hard to say. You know, historically, we have not had success with that. I believe there's a hearing in the House tomorrow. This is a bill by Representative Rogers and Senator Cantwell, and we'll talk about how Senator Cantwell is planning to be very active in AI legislation this year as well. And there was some talk about how we need a privacy law before we can have all these AI laws. So, you know, this is sort of a precursor as part of her whole package that she's putting together. We also had a presidential executive order prohibiting government use of certain commercial spyware. So if you're interested in that, you can check that out. We have another federal act that has passed the Senate and the House is considering this month. It's called the Report Act, and it updates the law related to online child sexual exploitation. It's more of tweaks rather than a major change, but it would require some changes by companies. So keep your eye open for that one. Now I'm going to talk about a few updates on the states that already had comprehensive privacy laws, and then I'm going to turn it over to Bianca to talk about the new state privacy laws and the health state privacy laws. So you may recall that California was the state that had the first comprehensive privacy law, and it has been operative already for several years, including the most recent amendment, the California Privacy Rights Act, which became operative last year. There were some amendments last year. One added reproductive health data and immigration data to the definition of sensitive personal information. So if you've done data mapping about California, it's time to update that with these new categories. That California Privacy Rights Act also set up the California Privacy Protection Agency. And that agency has been kind of in the getting going stage for the last year or so, but now it's fully going. So they have put out their first set of regulations. They were finalized about a year ago, and then there was a bunch of litigation that temporarily suspended them to being able to be enforced, but that is over and they are now enforceable. They also put out some final regulations in December of last year about data brokers. And they have a set of regulations that they've been working on for several months now that are likely to be finalized this year, including some on insurance, revisions to the existing regulations they had, the automated decision-making, which is like the AI type regulations, and then on privacy risk assessments. Kind of in the later category are cybersecurity audits. They also are working on regulations related to that. They recently put out their first enforcement advisory, which you can find on their website. It's about data minimization related to consumer requests. So if you're getting requests from people about their privacy rights, this relates to what types of information should you be collecting from them and what should you be doing with it. They also launched a resource site and a new complaint form. Last year's enforcement was still all by the state attorney general in California. Now we're kind of in a model where we have 3 enforcers. People can have a private right of action on certain claims. We can have the state AG enforcing it, and we can have that privacy agency enforcing it. But last year, the California AG had streaming services on his radar. He settled 2 cases, one related to location privacy and another on patient health information. And he was sending information requests to employers about employee privacy. There were lawsuits about security incidents. There were over 100 of them in 2023, so pretty active. California has a data broker registration requirement, and each year, more and more companies register as data brokers. We're up to almost 550. They also passed the Age-Appropriate Design Code, which is a children's privacy law modeled after the UK Age-Appropriate Design Code. That law has faced some litigation trouble. It currently has a preliminary injunction against it, which has been appealed to the Ninth Circuit. So we'll be watching that. They passed the California Delete Act last October, and this relates to that data broker registry because most people don't really have a direct interaction with data brokers. This Delete Act sets up a system where if you're a California consumer, you could submit one request to have something happen with all of your personal information at all of the data brokers in that data broker registry. It's not operating yet. It will be in 2026, but I think that's a trend that we will see in other states as well. Now turning to Virginia, which also went into effect early last year. They had one amendment last year, which was protection of genetic data privacy. And they also passed some children's privacy amendments this year, which went to the governor, but the governor returned the amendments to the legislature, and they're having hearings this month. So we'll have to watch the children's privacy developments in Virginia to see where that all turns out. Next, Colorado. So Colorado finalized their regulations last year, and they posted some additional compliance resources for people and businesses on their website. I mentioned the global privacy control, or the universal opt-out mechanism. That's basically a requirement under several states' laws where you have to set it up so that if somebody sets a certain setting in their browser, when they come to your website, they are treated as if they've opted out of tracking through these cookies. So the Colorado Attorney General had a period where he evaluated different opt-out mechanisms to see which ones he would approve. I think he looked at 3 or 4 of them, and he ultimately only approved one, which is the global privacy control. So that is required to be implemented in Colorado by July 1st of this year. And if you have questions about it, please feel free to contact us. He did start enforcing the Colorado privacy law, and he started sending out educational letters last July. There are several amendments underway this year of the Colorado Privacy Act, so we'll see which ones of those are enacted. Next, Connecticut. We still have a 60-day right to cure problems with compliance until the end of this year in Connecticut. But I think the most interesting thing that happened there was the Attorney General put out a report after 6 months of dealing with the Connecticut privacy law. And what I think is really interesting about this is it signals what we might see in other states as states learn what are the good parts of these privacy laws and what might need improvement. So he talked about his enforcement activities, including a letter he sent to a data broker that was allegedly selling health data to cremation companies, which is definitely on the high creepy level. But the interesting part is his suggestions for the legislature, and you'll see the themes here in some of the other privacy laws we'll talk about. One of the big challenges for companies is that the exemptions from these state privacy laws are all over the map. Like every state is slightly different. So we've got some states that will exempt an entire healthcare organization if they're subject to HIPAA in some part of their business. Others will only exempt the HIPAA covered data. And some exempt nonprofits, some don't. Same with financial information. So he wants Connecticut to not have these entity level exemptions, but only have the data level exemptions. He also wants them to enact a one-stop deletion mechanism for data brokers, like I just talked about in California. Also wants companies to have to disclose the exact list of their third parties that they're sharing personal information with rather than categories. And he wants to broaden the definition of biometric data to match organs. So you'll see, those are his 4 things that he's really pointing out after 6 months of dealing with it. They also enacted a lot of amendments in Connecticut last year. I don't have time to go through all of them, but the topics are listed here. Now I'm going to turn it over to Bianca to talk about the newer state privacy laws. Bianca?
Hi, everybody. Thanks, Jamie. So picking up where Jamie left off, here, as stated on the slide, many states have been considering comprehensive privacy bills, and those listed here on the slide have been passed, and we can expect them in the coming months and years. Generally, each comprehensive state privacy law will apply if your organization does business in the state or produces, targets, delivers goods or services to residents of the state, and typically comes with a minimum revenue threshold or number of users threshold. For example, the CCPA in California applies to your corporation or organization if you have an annual gross revenue in excess of $25 million in the preceding year, or alone or in combination annually buys, sells, or shares the personal information of 100,000 or more consumers or households, or your organization derives 50% or more of its annual revenue from selling or sharing personal information. Again, each state is slightly different with different exceptions and what have you. Next slide. And as many comprehensive state privacy laws exclude or exempt nonprofit organizations, it's important to note that certain states do actually apply to nonprofits or will soon in the coming months. So we have the Colorado Privacy Act, which came into effect in July of 2023, which applies to nonprofits. In Delaware, we have the Personal Data Privacy Act, which comes into effect January 2025. Oregon has the Consumer Data Privacy Act, which comes into effect in 2025 as well. And then in Connecticut, Washington, and Nevada, we have consumer health data privacy laws that also apply to nonprofit organizations. Next slide. Here we can really kind of see the breakdown of these comprehensive state privacy laws and consumer health data privacy laws, and then states that have either both or a privacy law that covers both categories of data. In Connecticut, for example, Senate Bill 3 amended the Connecticut Data Privacy Act to include certain obligations and restrictions on processing, sharing, and selling of consumer health data that is not otherwise regulated by HIPAA. In California, on top of the CCPA, California passed Assembly Bills 352 and 254 last year. This was in response to the Supreme Court's decision in Dobbs. And essentially, these new bills apply to organizations such as EHR developers, digital health companies, and will have certain requirements such as limiting out-of-state medical information disclosure or limiting cooperation with out-of-state inquiries and investigations into things like reproductive health care and gender-affirming care. And then finally, in Maryland, just earlier this week, they enacted a law similarly that limits the sharing of health information outside of the state and has certain guidelines around sensitive health information. Next slide. Now, focusing a little bit more into Washington State and the My Health, My Data Act, this law passed last year in 2023. And although it's called a consumer health data privacy law, the way that the law is written, it contains very broad definitions. For example, the word collection means buying, renting, accessing, retaining, receiving, acquiring, inferring, deriving, or otherwise processing consumer health data. So it really covers any sort of act that a company is doing with consumer health data. Furthermore, the act applies whether you are applies to residents of Washington State, as well as data that is hosted and processed in Washington State. As many of you know, some of the biggest tech companies in the world are located here in Washington, many of the biggest data hubs. So certainly data is being processed here in Washington. Furthermore, the My Health, My Data Act has very broad definitions of what actually constitutes consumer health data. So for example, here, the definition of biometric data will include things such as voice recordings and imagery of the face. It also covers things like precise location data. So often covering companies that may not traditionally consider themselves in the healthcare industry. For example, a corner store or a gas station that sells over-the-counter medication may be in scope for the law. A fitness center or a community rec center that allows people to purchase memberships will all be covered by the law. And finally, Washington State has a geofencing ban where you're prohibited from implementing a geofence of 2,000 feet around a location providing healthcare services. This law has a private right of action with steep civil penalties, and it went into effect on March 31st of this year. So we haven't seen any enforcement actions just yet in the news, but we anticipate those coming soon. Next slide. Nevada has a similar consumer health data privacy law. It is not as robust as Washington. The definitions of consumer health data are slightly narrower, and for companies, there is no private right of action. Instead, this law is enforced by the Attorney General of Nevada. Next slide. So in order to comply with these consumer health data privacy laws, there are additional steps that need to be taken, even if you're already complying with laws like CCPA or the CPA in Colorado or any of these comprehensive privacy laws. So in order to comply with the consumer health data privacy laws, typically a new consumer health data privacy policy is required with a distinct footer link that links to this disclosure. New affirmative consent needs to be obtained for the new collection, use, or sharing. There are certain restrictions on access to consumer health data that need to be implemented within the organization. Reasonable security measures need to be enforced. Organizations also have to enter agreements or DPAs with their vendors if they are handling consumer health data, and specific consent from users for the selling or sharing of consumer health data is also required. So typically, a whole new sort of set of requirements to comply with these different laws. Next slide.
Thank you, Bianca. So that was great on the health laws. I'm turning now to children's privacy, and really I could speak for hours about this because so many things have been going on. It has, I guess it falls into a few different categories, but there's definitely some overlapping. This slide is about age verification laws that have been passing in states for websites that have adult content. You can see a list of them here. The newest one was Florida, which was just signed March 25th. But several of these you'll note are enjoined or partially enjoined, and there's been a lot of litigation about these laws. I will say that they have been enacted and effective enough that Pornhub just pulled out of Texas completely as a result of this law. So it's definitely something to pay attention to if you are a site that has adult content. The other trend we've been seeing is the increasing age of consent. So if you're familiar with the Children's Online Privacy Protection Act, COPPA, that governs online collection of personal information from kids under the age of 13. But what we're seeing in these states is that these ages are going up, and many more teens are covered by the laws. So California and Connecticut enacted laws that had kids between 13 and 15 had to give you opt-in consent to use their data with certain types of processing. Then New Jersey came along and made it 13 to 16, had the opt-in consent. Connecticut has amendments that make it 13 to 17. And then the California Age Appropriate Design Code, which I mentioned before, which has been enjoined currently, relates to websites likely to be accessed by children under 18. And then the most controversial, maybe besides the California Act, is the new Maryland Act, which has the language that the website knew or should have known that it had people under 18. That is a departure from everything in the past, and is likely to be extremely controversial. Also, if you've been following the Federal Trade Commission, they approve parental consent mechanisms for children's privacy, and they just had before them the opportunity to approve a new parental consent mechanism that was age estimation software, which is popular in Europe, and they did not approve that. So that was rejected so far, but they could always bring it up again. The social media state laws you've probably heard about these in the news. Some of the states have really tried to restrict kids and teens' use of social media. Utah had an act that it tried to implement and was immediately sued, and now it has repealed and replaced it just last month. It requires you to implement age assurance of whether somebody's under 18 that is 95% accurate. So that's going to be a challenge. And then it has a bunch of other requirements, including default privacy settings for teens and supervisory tools for parents. Arkansas had a similar law that has been blocked in the courts. Texas has a law. Ohio, that one has a TRO that's been issued against it. Florida just passed a really broad law that says kids under 14 can't have social media accounts. Georgia passed one, Tennessee passed one, but all of these are facing court cases. So where this all shakes out in the coming months or years remains to be seen. But if you are a social media site, you should definitely be paying attention to this development. There were tons of other new state privacy laws passed last year. I have some categories here, but we don't really have time to go into all of them. But it's just like every month, it feels like years worth of legislation coming our way. The Federal Trade Commission is also looking at the Children's Online Privacy Protection Act. Their comment period just closed last month, and there are, I think, over 700 comments. They also issued guidance on a bunch of other issues, which I've listed here that you might want to check out. The Consumer Financial Protection Bureau was also active on privacy with a bunch of guidance for companies in the financial area. Now I'm going to turn it over to Ross to talk about health information privacy.
Thank you, Jamie, and thanks everyone for joining. Again, I'm Ross Emanuele. I'm a healthcare lawyer, and I work in the healthcare privacy and security space. I'm going to talk about Part 2 rules, which are privacy rules relating to substance use disorder patient records. Talk about an important case in Minnesota related to a state, Minnesota's Health Records Act, and also make a couple comments on that and a CMS development involving references to HIPAA. I'm going to make some comments on cybersecurity and healthcare, and then talk about the FTC's work in the health area. But to start off, the Part 2 rules are a set of federal privacy rules that have been around for many decades, much longer than the HIPAA rules, and they were amended in February of this past year to largely, but not entirely, align them with the HIPAA rules. So from an enforcement standpoint, from a breach notification standpoint, and from the notice of privacy practices, which if you are a HIPAA covered entity, you know what that is. It's the notice that you get at the doctor's office or at the hospital that shows all the ways they can use and disclose protected health information. These modifications to the substance use disorder rules align with HIPAA, so it's enforced the same. You can basically use the same sort of notice of privacy practices, and the breach notification rules are the same. The other big piece that the SUD or the Part 2 rules modified was to allow for a single written consent from a substance use disorder patient to allow for all of the treatment, payment, and healthcare operations disclosures that are permitted under HIPAA. The difference is you still need a consent from the patient. Under HIPAA, you don't. You can just, a covered entity can make disclosures for treatment, payment, and healthcare operations without the need for a consent. A Part 2 program has to get a written consent from a patient for these disclosures, and the consent doesn't need to be given. A patient could not sign the consent. They could revoke the consent later on. So that is a big difference still between the HIPAA rules and the Part 2 rules. Furthermore, every disclosure made with the patient's consent, including for treatment, patient, and healthcare operations, must be accompanied either with a summary of the consent, a clear explanation of the consent, or a copy of the consent. And that has to follow all the way downstream for any disclosures to a vendor, to a subcontractor, to anyone that the Part 2 program discloses to. In addition, there are still some disclosures that are more restrictive under the Part 2 rules than under the HIPAA rules, particularly any disclosures that involve any proceeding of any type against the SUD patient. The reason being that the rules are designed to prevent anyone from being disadvantaged by their decision to get treatment for substance use disorder versus someone who doesn't seek consent. And so there are still reasons for integrated systems that are covered entities under HIPAA, but have a Part 2 program within them to segregate the data and allow that data to be managed separately, because there are still some more additional restrictions that are more restrictive than HIPAA, and it's possible that some patients may not provide the consent or revoke the consent later on. So it doesn't entirely align with HIPAA, but it is a significant alignment with HIPAA that for those types of integrated systems should help tremendously. To move on, there is an important case in Minnesota from the Supreme Court about the Minnesota Health Records Act that also effectively aligns the permitted disclosures under the Minnesota Health Records Act with HIPAA's permitted disclosures. There was a disclosure from a hospital to its related fundraising foundation, which was clearly permitted under the HIPAA privacy rule. There's no doubt about that, and no one in the case suggested otherwise. But the plaintiffs argued that although permitted under HIPAA, it was not permitted under the Minnesota Health Records Act, which does have a private right of action. So they brought a claim, and the key issue was whether the Minnesota Health Records Act language that states that a provider regulated under that statute may not release a patient's health records without consent or specific authorization in law references or includes any HIPAA permitted disclosures. So is a disclosure permitted under HIPAA a specific authorization law under the Minnesota Health Records Act? And the Minnesota Supreme Court said definitively it is. So the Supreme Court said that that language, specific authorization in law, encompasses all law that is binding and enforceable in Minnesota, including federal law. So what that effectively means is that permitted disclosures of PHI under HIPAA are also authorized releases of health records under the Minnesota Health Records Act. Again, there is a private right of action under the Minnesota Health Records Act. So I think that what this means is that if someone wants to bring a claim under the Minnesota Health Records Act, they effectively, one of the things that they have to show is that that disclosure was not permitted under HIPAA, because if it was permitted under HIPAA, then there was a specific authorization in law for that disclosure, which means that Minnesota courts are going to be, or likely to be, asked to interpret HIPAA, even though there is no private right of action under HIPAA, and OCR may not have taken any enforcement action against the provider. So there may not be any external so to speak, reference to or finding that there's been a disclosure that's not permitted under HIPAA. Minnesota courts are going to be asked likely to determine whether there was. There is legislation that has already been proposed, and it's moving its way, at least through the Minnesota Senate, to reverse this decision and to add language to the Minnesota Health Records Act that the specific authorization has to be in Minnesota law. But we'll see if that passes. If we move on, there is also a statement from CMS, which administers a Medicare program, and CMS has a set of what are called conditions of participation that all hospitals have to meet to continue to be enrolled and participate in the Medicare program. One of those conditions of participation has to do with hospital medical records, and it says that those records have to be accurate, properly completed, properly filed, retained, accessible, and that the hospital has to use a system of author identification and maintenance that ensures the integrity of the authentication and protects the security of all record entries. Effectively, a hospital has to show that it has to have a system that can confirm that when someone makes an entry in a medical record, that entry is appropriate. It is the person that the entry says it was, and that there is security around record entries. And this raises the point that's been around for a few years now of how do hospitals who use a texting platform for members of the care team to communicate with each other do that, and can they do that and comply with these conditions of participation? And a recent CMS memo indicates that they can, but it also says that it must be performed through a HIPAA-compliant secure texting platform, and that hospitals should implement processes to routinely assess the security integrity of the testing systems and platforms utilized. So again, there's a reference to HIPAA from another federal agency, and I think it is appropriate for CMS to allow secure texting platforms to allow communication among care team members. But the question that I think is really interesting is if CMS if there is an incident involving texting and CMS wants to find that there was a conditions of participation violation, but OCR has not acted, can CMS find that a hospital's texting platform was not HIPAA compliant or was not used in a HIPAA compliant manner? Similar to the Minnesota courts being asked to interpret the Minnesota Health Records Act, as I talked about with the Minnesota Supreme Court case, I think it is possible that in the future CMS, because of this memo and this new guidance, may find itself in a position of having to interpret whether a texting platform or the way that a hospital used a texting platform complied with HIPAA or not, even though OCR, which is ostensibly the only federal agency that can force HIPAA, has not made a finding that there's been a violation. I want to talk about for a couple minutes what I think is a really important issue for the healthcare industry at the moment, which is cybersecurity. I don't have any slides on this, but there has been a couple developments recently. First, that are indicators of what I think could be a regulatory approach for security in the healthcare industry. The New York Department of Health has proposed very specific regulations for hospitals around cybersecurity that sets very specific standards around a security compliance program, a security officer, auditing and monitoring, authentication of individuals that use systems, risk assessments, training, data incidents, and reporting. And it is specific to the point that there is a standard, at least in the proposed rule, of course, could be changed, that a New York hospital that suffers a security incident that has a material adverse impact on any hospital, on the hospital or a material hospital system, has to notify the New York Department of Health within 2 hours of that incident. Okay. Another development is that HHS, the Department of Health and Human Services, has put out specific guidance on the security rule. Those who work with HIPAA know that the HIPAA security rule is scalable, flexible, it's technology neutral. It does not stipulate what any particular hospital, doctor's office, pharmacy, lab, what have you, type of provider that's covered entity has to do. It just sets out a set of standards, and you have to act reasonably and diligently to implement those standards in a way that's appropriate for your organization. HHS has put out a set of guidance on implementing compliance with the security rule. There's much more detailed and specific, and sets out specific questions and tasks that covered entities can do to comply with the security rule. That is welcome. I think for the most part, it's good guidance. But I think combined with the New York hospital proposed rules, which may be replicated in many states, in other states in the future, and this more detailed guidance from HHS may be a harbinger of more specific security rules that are not as technology neutral, that set specifications for covered entities. I think we are starting to move in that direction, and I think the reason for it is that because of the way that the compliance with the security rule has been enforced, and the fact that the security rules are so technology neutral and scalable and flexible, it has, for many parts of the healthcare industry, allowed covered entities to not do what they should be doing from a cybersecurity standpoint. Not all, of course, covered entities, but I think we all know that there are many covered entities that don't do comprehensive risk assessments every year. They don't do many of the things that they should do. And I think that a combination of the security rules being flexible and the fact that enforcement of the security rule really happens after the fact, if there is in fact a reported security breach, has allowed that to happen. So my comment would be that now is the time for covered entities to focus on cybersecurity and really come to the realization that cybersecurity is not ancillary or corollary to their core mission of treating patients. It is absolutely core. It is nearly, if not as core, to a provider's mission to furnish quality clinical care to a patients as clinical safety. If providers are so dependent on information flowing among care teams to payers to others, that when those shut down, that is a patient safety issue. So again, my comment would be now is the time to take this seriously, do comprehensive, thorough quality risk assessments, take the HHS guidance seriously and implement it. And if the regulation continues to be more specific on the cybersecurity standpoint, from a cybersecurity standpoint, those covered entities, providers that do that are going to be in a better position. Okay, let me finish with Federal Trade Commission enforcement in the health industry. If we could go to the next slide. So the Federal Trade Commission also enforces in the healthcare industry. There is an FTC health data breach notification rule. GoodRx was enforced against by the FTC for failing to comply with that rule. Other healthcare apps and services that are not covered entities, because either they are an app that you just pay for out of pocket, or it's a counseling service that they pay for out of pocket, have been enforced against for not being truthful or omitting important facts about how they share data for advertising, how they disclose it to third parties. So there have been significant penalties and enforcement actions in that area. And a genetic testing service, again, not a covered entity because all the payment is out of pocket. They don't deal with payers, was enforced against because they did not tell in their privacy policy users of their service accurate information about how their data is deleted. They changed their privacy policy retroactively, and instead of making those changes only with regard to the data that was submitted or that they collected, after they made the change, they went back and retroactively changed it for the data that they already had without obtaining their consent. And so for those in the healthcare industry who avoid HIPAA regulation, it is not by no means the fact that you are free from federal privacy and security regulation, in addition to all the state laws that Jamie and Bianca have talked about before. And, you know, HIPAA is 20 years old. And when HIPAA started out, many, many organizations, particularly those who provided some services to health plans or healthcare providers, did sort of gymnastics to try to avoid HIPAA regulation and to minimize the impact or where within, you know, the sets of programs or divisions or business units within their organization were regulated by HIPAA, because there was nothing else. And so if you could avoid HIPAA regulation, you were basically avoiding privacy and security regulation. That is no longer the case with all of the state laws and all the things that we've talked about to this point. So that risk-benefit analysis of whether it's better to avoid HIPAA regulation than not, I think for many organizations would probably change at this point. So that's my last comment, and I will turn it over to Austin.
Great, thanks, Ross. Welcome, everybody. And so the FTC, aside from enforcing against healthcare companies not subject to HIPAA, they're of course very active across different domains and are probably the most robust federal regulator for privacy and data security issues. And interestingly, over the last several years, the FTC tends to work in terms of settlement agreements. So they enforce against unfair or deceptive trade practices for companies, which has been interpreted to include privacy or security violations. And over the last couple of years, we've seen a few trends, which interestingly sort of align with what we've seen at the state level. So I'm going to cover kind of like some of the larger, more significant Federal Trade Commission settlements over the last year or so. So again, aligning with sort of the state's children have been a huge focus for the FTC. The FTC is the enforcer of HIPAA, the Children's Online Privacy Protection Act. So these, again, not under their unfair deceptive trade practice authority, but again, just for enforcement of HIPAA. But again, FTC has been very robust, very active here under enforcing HIPAA. So first, the big one, Microsoft was fined $20 million for violations of HIPAA here. This involved Microsoft not obtaining verifiable parental consent, which is required when you collect data from children under 13. Here, this relates to Xbox Live accounts. So basically, children were able to go and create an Xbox Live account. They could provide account information, an avatar, and some other information. And Microsoft was able to collect all of that information and then basically said, please involve a parent before you, and to get consent. But they never actually obtained that verifiable parental consent. So FTC, of course, found out about that, and they have forced Microsoft to delete that data and go and seek parental consent in addition to the fine. Amazon also, everyone is familiar with Echo, so Amazon's Echo device was collecting information from children, and Alexa, the service, also embedded in other children's or children-targeted devices. So Alexa was again collecting all of this information from children. Amazon did not disclose that clearly to parents, and also did not delete that data. So there were issues that basically, if a parent did eventually come around and say, I want you to delete my children's data, Amazon failed to do so. And so again, FTC stepped in and just stopped to that, and again required Amazon to delete children's information and to put in a new process to delete that information more quickly on a go-forward basis. Sort of the last major case under HIPAA with FTC is this Edmodo case, which was an edtech vendor. So this was a first for FTC recently. It was really focusing on edtech providers. So in this case, although schools are able to collect parental consent on behalf of parents, basically through an authorization, they failed to do so. They failed to provide notice to parents about how they were collecting data, what they were going to do with it. And once again, we see FTC requiring that Edmodo destroy data as one of the remedies, and of course collect only what is minimally necessary to provide the service. Next up, another big focus area and kind of an interesting development here with respect to biometrics. So in this case, the FTC alleged under its unfair deceptive trade practice authority that Rite Aid failed to implement reasonable measures to prevent harms in relation to use of biometric technology. Essentially, Rite Aid was collecting biometric information, usually face scans, in connection with certain services that it offered. But what was interesting is that they didn't provide, so they failed to implement reasonable measures to prevent harm. They didn't assess the harms that might come of it. And what is very interesting about this case in particular is that FTC, as part of its authority, required that Rite Aid not only delete the data that they collected, which was the face scan, they also had to delete all the models and all of the training data that were generated through the facial recognition models. So this was a comprehensive sort of deletion of data remedy. So again, very, very important to watch. And we saw this again a couple of years ago with the Ever album case. Again, this was facial recognition, facial identification in a photo album. Again, same remedy was sought by FTC, required the disgorgement of both the underlying data as well as the models and training data related to that. So the last focus area for FTC has been sort of location data, and we can kind of expand this out to data brokerage and data aggregation, really getting at basically consumers not knowing or not consenting to the collection and sharing of certain sensitive information, be that precise location information or browsing data, or other sorts of data that these data brokers in the background are collecting, aggregating, and selling about people in the background. So this, again, sort of FTC's attempt to continue to pull that thread the states are to have as well around data brokerage, and really trying to get more transparency and to start to crack down and limit the purchase and sale of information around consumers, but in particular sensitive information such as browsing data, location data, things like that. Next slide, please. Sort of again at the federal level, surveillance is an important issue, as it has been for a number of years. One of the developments that we have is Executive Order 14086. I won't spend a lot of time on what this is. This is basically an update to FISA Section 702, which is one of the main federal laws authorizing foreign surveillance. What's important about this change is that the changes that were made by executive order have allowed the data privacy framework, which is the European EU-US data transfer mechanism. So for many years, of course, there's been a lot of challenges around data transfers between Europe and the United States. These changes significantly curtailed, at least allegedly, the ability for the US surveillance authorities to monitor and collect data in bulk around non-US persons, at least those in Europe and qualifying states. And so with that, it has also given these qualifying states, such as Europe, an ability to basically complain and seek redress through the Data Protection Review Court. All of these changes, again, allowed the data privacy framework to take effect. And it, of course, has been challenged in Europe again, but now there at least is a mechanism similar to Privacy Shield, for those of you who are familiar, that is back in effect at the federal level. Of course, FISA itself is up for reauthorization. This is sort of a developing issue. I believe at last check, the amendments have passed the House, but of course it faces an uncertain path in the future with numerous senators and others trying to seek further amendments or to kill reauthorization of FISA. So something I would continue to watch in the coming year. Next slide, please. And again, at the federal level, again, following the thread of several states who have attempted to ban social media, and we have the TikTok ban, which is attempting to force a sale of TikTok and from its Chinese parent company, and would also ban TikTok from US app stores. Again, this faces considerable both political and constitutional obstacles, but again, something to watch, especially as these constitutional challenges develop. And as I think we'll talk about a little bit later, at the federal level, we've seen an executive order 14117, which is banning sensitive data transfers, but again, really getting at AI and the sharing of information about consumers with companies in certain states, such as China. So stay tuned to panel 2 for more on that. Next slide. Back over to you, Jim.
So speaking about artificial intelligence very briefly here, I wanted to just highlight a couple points about it. And one of them is that there are lawsuits pending now about how AI systems have been trained, and the fact that when they scraped information off of the internet, it contained a lot of people's personal information, and that potentially users asking AI systems for things can get information about other users. It's important to make sure that the default settings of your employees, if they're using AI, are set so that it's not training on the information that they're inputting. Secondly, there's a lot of questions about how the AI systems could train on people's personal information when we've got federal and state privacy laws that require prior consent. So, for example, if you collect sensitive data or data about a known child in Colorado, you have to get opt-in consent before that. If you're just scraping off the entire internet, how could you have done that? So I've put some questions on this slide that will be likely addressed in many of these lawsuits. most of us are dealing with contracts related to AI, and there's a lot of issues there in terms of risk allocation between the parties, all these unknown issues about scraping and training and output and who's going to be on the hook for those, making sure your insurance covers you. And then are your planned new AI uses consistent with the privacy representations in your privacy policy? If not, you may need to revise your privacy policy and get new consent from people. And do you need new data processing agreements related to AI? Probably you do. Finally, are your uses that you're planning to do consistent with the AI providers' policies? So for instance, ChatGPT in their policy has a prohibition of using it for certain financial or medical advice. So are you planning to try to use it for something that they don't permit you to do by contract? You probably heard about an executive order about artificial intelligence in the US that is this massive, many hundred of page document. I've put a link here to an executive order timeline, which kind of breaks out where we are. I think we just passed the 150-day mark, and each agency has certain deadlines, but one of the things specifically mentioned in the executive order is promoting privacy. So we're likely to see more regulation this year. The Federal Trade Commission, as Austin was talking about and Ross was talking about, has also been active in AI. They've had several announcements about AI, which I've listed here. And the Department of Commerce has been active with AI. I specifically recommend checking out the Artificial Intelligence Risk Management Framework from NIST. And the states have been super active. There are over a dozen state AI laws, multiple regulations, and many more to come. Federal legislation, I'm just going to skip and turn it back over to Austin here.
Thanks, Jamie. So I think one of the last things we wanted to cover here is sort of the private industry developments. So alongside CCPA and the other state privacy laws, kind of one of the big focuses really is around ad tech and behavioral advertising. And so this is sort of dovetailing with a lot of developments in the ad tech space itself, both designed to address the compliance challenges around the state privacy laws, and also just to, again, create a more privacy protected product. So Google, probably the biggest player in ad tech, has started to make several significant changes. So this is, for those of you familiar, this is Google Analytics 4 GA4. It has replaced Universal Analytics, which is sort of the prior version. What is important about this is that this is a cookieless type solution, or they're really trying to move away from third-party cookies, which allows tracking of user behavior across multiple sites. They're using instead predictive analytics and other sorts of information collection that are a little bit less deterministic, a little bit less linked back to an individual, but again, designed to still give you the analytics information you want about how people use your website. The important thing, of course, here is that there are cases with GA4 that allows data sharing with Google and cross-site tracking if users opt in. And so it does require some work on the implementation side to make sure that Google Analytics has been implemented in a manner compliant with the state privacy laws and in compliance with Google's own contractual requirements in terms of service. Similarly, Google Ads, moving cookieless here, again, really trying to end third-party cookies, browser fingerprinting, all these sorts of privacy invasive sorts of methods for collecting advertising information. So they're moving to what is called a privacy sandbox, which is collecting data and storing it within a browser and not sharing it. But basically, advertisers can access a sort of on-browser set of information and then target ads to users that way. So again, things to watch, again, things to monitor and make sure that these are being implemented in compliance with Google's requirements and applicable law. Next slide, please. Also in the advertising space, IAB, one of the largest trade organizations, has rolled out its multi-state privacy agreement. This is a sort of comprehensive set of tools that allows for people who sign up to basically pass through opt-out signals throughout the display advertising chains. This is similar to the TCF, which is in Europe. Again, both of them trying to get all of the vendors in the ad tech space on the same page and respecting user choice around opt-out with ads. Again, implementation challenges abound, but certainly something to pay attention to if you are engaging in or in retargeting or behavioral advertising or display advertising. Next slide, please. And then finally, in relation to cookies, sort of layered on top of all the compliance and contractual challenges we have with this emerging litigation. We'll talk a lot more about this in the third panel, but just be aware that there are increasing claims in California under old wiretap laws, alleging that advertising technologies, in particular social media pixels, involve wiretapping. So stay tuned in the third panel for more information about that. Next slide, please.
So we're going to wrap up here. We've put some key issues for 2024 on this slide. We're likely to have more and more state laws. We're up to 20, and I expect we'll be at a higher number before the end of the year. So working on complying with those laws is going to be a really high priority item for all US companies. We think we'll see more health data laws like the ones Bianca talked about in reaction to Dobbs, and we'll likely have the Venn diagram that she showed change over the year. All the AI challenges, voice cloning, deep fakes, and our election is likely to be a very important issue this year. What do you do about AI that's been trained on stuff that maybe it shouldn't have been trained on? I think we're going to see requirements to have machine unlearning and disgorgement, like some of the FTC proceedings that Ross and Austin talked about. And then I mentioned at the beginning the overlapping and somewhat inconsistent requirements between privacy and AI laws that we're seeing in the states. Third-party cookies, Austin covered, it's going to be increasingly difficult to use them in a legally compliant way, and the risk of using them and the litigation associated with them is increasing. Children's privacy laws, many changes to HIPAA, more state laws, more constitutional challenges, just a lot of activity. Health-related, enforcement related to pixels and other trackers in a similar way as we were talking about with other websites. We'll see dark patterns enforcement and the wiretapping cases continue. Now we are going to take a short break and we will resume at 9:40 or whatever hour 40 that you're on. Thanks so much for this first panel, and we'll look forward to the international panel coming up.